you try to leave it in a better condition than when you left it or when you found it. You just kind of leave it better. And legacy, like I said, it's paying back. It's what can I do to give back um, to the profession. I when I did honestly when I floated down to the emergency department that one night, it was the first I'd been in the Air Force for 5 years before I went to nursing school. And I was a medic in the Air Force, and so I worked at a little emergency department on a base hospital, and so but I was like a EMT or a medic there, and in our so I had some emergency department exposure, but when I got floated down, and I was like, this is where I need to be. And I remember going home and telling my wife, I need to go there. And she's like, then apply and go. I'm like, I will. And I got hired, and it's like,
That's cool.
and I really did kind of feel like I was home. It's like, oh, yes, this is where I need to be.
That's
So,
awesome. I love hearing that.
Hello, and welcome to the Art of Emergency Nursing podcast. This is where we share stories for inspiration, entertainment, and encouragement because we all know emergency nurses have the best stories. Now, here's your host, Kevin McFarland.
Hey everybody, Kevin McFarland here from the Art of Emergency Nursing, and thanks as always for downloading this episode and listening to the podcast. Hey, don't forget the other podcast that I do at Lisa Wolf called How Not to Kill Your Patient. That one's a little bit more clinical, but I think if you dig this podcast, you're gonna dig that one just as much. So check out that podcast too. My episode today, I have my friend Roger Casey here. He's been a nurse for over 30 years and has been in the emergency department for over 20 years. He is a bedside nurse. He's been a leader. He's been an educator. He is an author and super involved in trying to make emergency nursing just a little bit better. He is a fellow in the Academy of Emergency Nursing, and he's one of my favorite people to follow on Facebook. So I'll include his Facebook information down below with his permission, of course. He often posts what he calls the Trauminator Top 10s. And oh my gosh, some of those are funny. Some of those are super poignant, but they're always super relatable. So if you're looking for someone to follow on social media, he is a great follow. But for now, listen to this episode and you're going to really dig it with my friend Roger.
well, for those who don't know me, I'm Roger Casey. I've been a nurse for probably over 35 years now. Um, been in the emergency department for about 26 of those years or more. And it was interesting when I got to the emergency department. I actually was on med surg and I hated it. Hated it. Got floated down the ER one night and I'm like, whoa, I like this place. It serves my ADD well. You know?
Yeah,
And so,
I think that's how a lot of nurses get started in the ER.
yeah, so there was a position open. I applied for it, got hired, and I've been down there and done really a lot of different things. I was a charge nurse. I was a educator, then I was a trauma coordinator, and then I left the hospital and was a base chief. So I managed a critical care transport company for a couple of years, and then um, they got bought out by another company. So I went to I'm now working at a freestanding emergency department at nights as a night charge nurse and done a few things. Um, let's see, I'm not even sure how to even explain some of the credentials, but I you want to talk about the alphabet soup after my name. You know,
You got a
I
few.
yeah, I'm a fellow of the Academy of Emergency Nursing, so that was kind
That's
of
the
weird how
big
that
one.
happened.
That's the big one, right?
I was president of Washington ENA, and Anne Marie Papa was, man, I'm just name dropping this episode. I'm just all these names I'm dropping. Um, she was the past president, I think, and she was our state liaison. And anyway, somebody had um, told me to apply because they thought I would do it, that I'd be qualified. I'm like, wow, are you kidding? I'm like a nobody. Out of like, look at all those, who's who of emergency nursing throughout the U.S. It's like I'm nobody. And um, we had Anne Marie Papa out for a conference, and I had a chance to sit down and talk with her, and she's like, absolutely. She goes, but wait till after your presidential year, get through it, because I'm looking at all these things you're doing as president, of Washington State ENA, and I think that you need to like get all these things established and then apply. And so I was still working on with BCN at that time as well, volunteering as an item writer. I was at the time the state um, insurance commissioner was going to do a retroactive reimbursement policy on emergency department visits, and so they weren't going to allow, they wouldn't reimburse for certain um, visits, which included chest pain, abdominal pain, some other things that were true emergencies, and because of the overuse. And so we partnered with the American College of Emergency Physicians in Washington State, and we came together and we kind of developed a little task force with 7 different things that we did. And one of them was to be able to track information, because when HIPAA came out, you used to share information with emergency departments. And then when HIPAA came out, you'd call and say, hey, do you have records on this guy? I'm like, do you have a consent signed? Do you have their permission? It's like, no, oh, can't do it. So they developed a system called EDIE, Emergency Department Information Exchange, throughout the state. And so one of the things that they were cutting down on or the reason they were implementing this policy was because these people, frequent flyers, super users, MVPs, whatever you call them, were putting a strain on it. And so they found that a lot of these people were going ER to ER to, shop for drugs. And so one of the physicians, I think in Spokane, developed a system to share information. So it pulls up like pharmacy visits, it pulls up emergency department visits, pulls up like any kind of controlled substance um, uh, prescriptions and how many they had. So you have that kind of at your fingertips. And then we started like a managed care thing. And so that was all kind of some of the part of my um, application for the free or the fellow of emergency nursing. And then Anne Marie Papa was one that kind of was my mentor for that. And I was surprised actually when they said I was accepted. I'll be honest. I was like, I still feel like I'm a nobody. Like I'm,
It's, it's kind of funny. You go to these meetings and they have, for those of you who don't know, they have a fellowship meeting, an academy meeting every year at the conference. And you look around that room and it's a who's who of emergency nursing. Like there is like legends of emergency nursing in there. And then if you're like me, I'm looking around going, and I get to come in too. That's pretty cool.
like, I don't think I belong here.
Yeah,
I
you're
think
like,
I belong probably, where's the principal's office? I need
yeah,
to be there.
you're like, I feel like the kid eating at the adult table, right? Like that's how I felt about it. And
I'm not prepared for this discussion. I'm sorry.
right. And,
You want to play the toy?
and now now like this year I'm on a committee. I'm on a committee for the academy where we're looking at some guidelines and some recommendations around triage. And I'm like going, I get to be part of that too. Holy cow, this is cool. Like with amazing people. And these people are all my friends and they're all amazing. And I'm like, how cool is that?
Yeah.
So
Yeah.
it's humbling. It's super humbling. And you always think, I remember when I got approached the year before I applied, I got approached by 2 people who were like, hey, you should apply for the academy. I'm like, me for what? For getting on a microphone and talking shit with my friends? Like that's not academy worthy. And they're like, it really kind of is. It's like,
We had
all right.
started, we had partnered with British Columbia emergency nurses. And so we had like an international emergency nursing conference, which I think was the first of its kind. And we did, I think, 3 conferences. We went up there one year and then they came down to Seattle and we had, you know, US speakers, we had a Canadian speakers, and then they had the conference, in Vancouver, BC, the year after that. And so just being part of that was really cool. We were trying to get it to be like a regular kind of thing, but I think just finances on both ends just kind of stopped that. But it was kind of fun, like learning, you think like emergency nursing here would be different in Canada, but face they face a lot of the same issues. For them, it's not reimbursement. They have like it's almost like them living in a fixed budget, like a fixed income versus us and reimbursement. But Yeah, a lot of the stuff that they do up there is pretty cool. In fact, the ESI is very similar to their Canadian triage system. Theirs is based on time.
Yeah.
You need to be seen now, within 15 minutes, within 30
Yeah,
minutes.
that's one of the big differences between ESI and the CTOS, I think it's what it's called.
Yeah.
Um, and yeah, it's like the time frames that we would never be able to meet in most emergency departments in the US. But it's interesting that they are very similar.
Yeah.
And the reality is it's like nursing is nursing, right? Taking care of people is taking care of people. And I know ENA has done multiple like exchange, exchange programs where they send people to different countries. And I think oftentimes you see that they may be either a little ahead or a little behind us, but they're doing the same job. They're still taking care of people.
Yeah.
So
Some of the, yeah, some of the trauma services, like you go to England and the UK, they really have a good trauma system in place, especially like for disasters, because you think about all the stuff that they've had to go through.
yeah.
Um, Israel, I think, has a really good disaster kind of system in place. Australia is another one that has a pretty decent system in place, and their emergency care systems, through all that.
Yeah. How has it been different for you, going from, either the bigger emergency departments, flight, and now in the freestanding emergency departments? Freestanding emergency departments are kind of new in some communities. Some communities have a lot of them. We have quite a few here. Texas has really adopted that model, and it's really helped kind of decompress some of our bigger emergency departments. But how is that patient population different in the freestanding than it is, for instance, in the, like the academic medical center that maybe you worked?
So the freestanding that I work in is actually associated with the hospital, and so there's three cities in the Tri-Cities, Washington, where I live. There's Kennewick, Richland, and Pasco. The main hospital is in Richland. It's a regional level 2 trauma center, and we have a 18-bed freestanding emergency department in Kennewick. So where you have, if you're going to get admitted, the first call is to the hospital. It's just like basically having another emergency department, but it is
Yeah.
offsite. But people don't see it as that. I don't think people understand the concept of what a freestanding emergency department is. They just see the big red emergency and they think it's an urgent care, or they think it's associated with the hospital in Kennewick, which is a different hospital. And so I think a lot of people just think it's a clinic. They're surprised when they get the bill, when they get emergency department pricing.
Yep. It's yeah, I was gonna say, certainly here we have a lot of urgent cares, but um freestanding emergency departments, and it is an emergency department copay. Like it's an
Yeah,
emergency department. You're not going to a urgent care on steroids. You're going to the emergency department.
yeah. So because we're associated with the hospital, um, we are able to get people to go to hospitals. Um, we send them either by private vehicle or by ambulance. But the one thing we don't do is we don't get a whole lot of ambulance traffic. We do get some, but we don't get like traumas or cardiacs or strokes by ambulance because Washington State has a trauma system and they also have a cardiac and stroke system um, with their EMS as far as designated cardiac and stroke centers to go to. So we are not part of that. So we don't get traumas unless they come in off the street. We don't get cardiac or stroke unless they come in off the street. And so that's one of the differences there. We do
Do,
tend to
do,
see a
but
lot
do
more.
do you get ambulance traffic?
We do, yeah. We'll get the occasional, nursing home. We always joke that, the nurse at the nursing home made rounds and discovered that Aunt Phyllis is not feeling well, so she's got to go to the emergency department. So
Yep.
they'll bring it here.
Always.
And, you know, through COVID and especially now, um, we're we all are facing diversion issues, kind of like back when EMTALA first came out, or the reason why there's EMTALA with all the diversion and stuff. So we do get some ambulances there that should have gone to the main because they're on divert, but we're not, kind of thing. But we're busy. I mean, I worked uh, this past weekend, and there was one day we saw 115 patients, and we had 10 admits, for an 18-bed, ED. stand alone.
It's a lot.
People think we're a little hospital. Like, no, we're not a little hospital. We're a detached emergency department. We have fixed resources though. So like if somebody calls in sick, they try to send us somebody from the main, so they will float somebody over from the main hospital. But if there's a code or if we have like multiple sick people, I mean, we're running. And so it can be kind of scary at times. But it's not as busy as the main emergency department is, but there's some nights though that it can be.
Yeah. Yeah. I mean, so I recently, when I was sick, I went to a freestanding ER. And one, I was stunned how fast it was. Like it was super quick and it was, full ER visit. Like I seen an ER doc, I seen an ER, I think I seen a PA. I seen an ER provider and, they treated it like an ER visit and, got me squared away and sent me on my way like super quick. Like I was like, I was sitting there going, oh, I'm going to be here all day because it was busy. It's
Yeah.
still pretty fast.
We do have um, some long patient wait times depending on how busy we are. And we also, if the hospital is full, if they don't have any beds, then we board them. So we do have boarding. Um, and there are times, and we have CT ultrasound in our own little lab. So
Yep.
we have X-ray, CT, ultrasound on the lab, all built in right there. But yeah, if there's things that we can't handle, like if they have to get blood, it's easier to send them over to the main emergency department so they can get blood
Yeah.
because it takes about 20 to 30 minutes of transport time to get back and forth. So if we had to get blood from the hospital, it'd take about 30 minutes, which is kind of like on the edge or just outside of their um, time frame as far as having the blood out before it can be administered. So there are some challenges to that. Obviously, we don't have like the surgeons there or the cath labs where they can go right
Of course.
away. If we have somebody comes in with a STEMI, we have an agreement with the local EMS. We call them. We just basically call 911
Yeah.
and say, "Hey, we need this guy to go," and they respond. And usually they're there within 5 minutes, and we're loading that patient up, and then they're out of here. So,
Yeah.
but yeah, there's some challenges. It's kind of a different but same. It's just you have limited resources.
Yeah. So how long have you been an ER nurse? You said like 30 something years?
27 years. I've been I've been a nurse for about 35. About 27 of those have been in the emergency department or emergency department related. So the vast majority of my career has been in the emergency department.
And then I think when we first met, I think you were doing flight. You did flight for some years too, didn't you?
No, I managed a flight company. I wasn't
Ah,
doing flight. I
oh, okay.
managed a critical care transport company that had um, the ALS unit. And it's kind of funny, they had just started the ALS service to transport patients from the freestanding boat to the hospital. And so I was managing them. And then we also had a fixed wing and a helicopter. So I managed the base here for that transport company. And then they got bought out and they let all the managers go. And I was okay with that because there's some things in my life that were going on that it worked out well looking back. But at the time, it was kind of painful. But I knew the managers at the main and at the freestanding. I'm like, hey, I need to come back. And they're like, yeah, we're happy to have you. So I've kind of been
Yeah.
there.
Isn't it
It,
isn't it funny how isn't it how funny how like when one door closes, you sit there and think to yourself, oh man, that's bad. And then you look back and you're like, oh no, it was a great thing. What a blessing. You
everything
know?
happens, I truly believe everything happens for a reason.
Mhm.
And
I agree.
and at that time in my life, um, my wife was not doing well. She had some surgery at the Mayo Clinic. She was back in the Mayo Clinic. I was back here with my son, and I was dealing with that. And then there were some issues going on in the flight company that I was kind of dealing with, and it was like, you know what? It's like I don't know if I can continue doing this. And then our company got bought out by our competition, and they gave me a big severance package, which was actually nice. I wasn't even expecting that, but it was nice. Um, and at and then so I was able to spend some time with my wife, who was then transported to more closer to home. And then she eventually passed away a couple months after that. But that, looking back at that time, and people would say that to you like, oh, it's such a blessing you're not. It's like, I got to go find a job now, and my wife's not doing it. I was like, what are you talking about? But it was, looking back, yeah, truly. I mean, I can see, like, looking back at my life, I can see God's hand in all of everything I've done. And it's true, like when one door closes, another door opens. And I firmly believe that things happen for a reason.
Yep.
And, you know, after she passed, is when they asked me if I wanted to be on night shift. It's like, yeah, I'll be on nights for a while. 7 years later, I'm still on nights and still plugging away. And then after COVID, you're like, why am I still here? Why am I still doing this? But, I'm remarried and um, to a wonderful, wonderful lady. And we met through a mutual friend and um, we just hit it off and we got married during COVID in the backyard. And yeah, we just are to the point now where like, okay, our kids are grown. So now what do we do until we retire? What can we do to save so we can retire? And
Yeah.
what do we want to retire? So that's kind of
That's
where I'm
cool.
at. And then you start thinking about your legacy and what have you done? Have you left it in a better place than when you found it?
I think
Like
that's what most nurses want. Like I think, I I think what I see is I see like a handful of nurses that just want to go in, they want to do their 12 hours and go home. They're not thinking about legacy. They're just thinking about how do I get through this shift?
they're just
Um,
renting space, man.
yeah, yeah. And but there's a handful of nurses, and they're usually the ones that I've seen kind of be more involved in like the organizations and stuff that want to look back and say, okay, did I make a difference? Did I have an impact on the practice of emergency nursing? And I think that's that's what the academy is all about, right? It's like those people that are going to have an impact on the practice. Um, and there's a lot of people that do that, and I think that's something that a lot of people who are like super involved or really committed to emergency nursing. That's one of the things that they think about is like, what's going to be my legacy? What's going to be my impact?
And I was super involved with ENA and BCN, and still with BCN, not so much with ENA, because like after you have a loss, like when my wife passed, it just really kind of made me stop and refocus. What are my priorities? What is it that I really want to do, and what is it that I really want to? Where can I best put myself and you know expend myself doing? And I think that kind of made me kind of scale back on some things, but it's interesting when you talk about um, impacting people and whatnot. There were a couple of patients that I had. One guy was in COVID. He was not from this country, and he was up here. He was getting ready. It was around this time of year, a couple of years ago, and he was working for a company, and they were at a dinner, and it was like the boss's daughter brought him in because he was having a hard time breathing, and she was in there and she was watching us, take care of this guy, and he just like went downhill fast. He like started desaturating. We couldn't get the sats up. I don't know if he tested positive for COVID. I don't know if he was COVID positive or not. Um, and we did everything we could to kind of um, take care of him, and then we had to intubate him, and then we sent him over to the ICU at the main hospital, and he died a few days later. And the lady that was there, who was like his boss's daughter, brought him in, was just amazed at everything that we were doing. And I kept looking at her, going, "Hey, you're okay. Are you okay?" And she goes, "Yeah." She goes, "I'm fine. You just do your thing." And it was funny that this was a couple months ago. I was thinking, I wonder what happened to that lady, because I think that guy died. I think I remember hearing the guy died, but I always wondered what happened to that lady, because she was in there watching all of this, and I wondered how she was dealing with it and how she did with it. I was walking by a room the other day, a couple months ago, and they put their light on or something. So I walk in, and as soon as I walk in, it was the lady. I didn't recognize her at first, and she looks at her dad, who's the patient. She goes, "Oh, Dad, you have a great nurse in your room here right now." And I'm kind of like, you know, do I know you?
You're correct, but thanks for noticing. I don't know how you noticed, but you're absolutely correct.
Well, I said, you look familiar, and I just can't place you right now. She goes, I was here with this guy and explained. I said, oh yeah. I said, and it's funny because I took care of what her dad needed. But I said, it's funny that you say that because just the other day in the car, I was driving and I just thought, I wonder whatever happened to that lady. It just kind of popped in my head. Wonder whatever happened to her. And she was doing okay. I said, how are you doing? You doing okay through all that and stuff? She goes, yeah. She goes, you guys did such an amazing job. And she said, as soon as you walked in, she said, I saw you walking back and forth there by the charge desk. And she said, as soon as you walked in the room, I just told my, I had to tell my dad that you had such a great nurse taking care of you because you were the one that was there helping this guy and all that. I'm like, whoa.
You're like, wait,
And
didn't he die?
yeah. But then there was another um, time I was walking out into the waiting room and I walked past this lady and she looked up and she smiled at me and, I smiled back. And then um, about a half an hour later, one of the coworkers like, "Hey, Roger, can you help me with this dressing in here? It's a dog bite." And so I go in, and the lady is with a friend, you know, um, who got bit by a dog, and she goes, "Oh my gosh," she goes, "You have such a good nurse taking care of you." I'm like, "Okay." And it's like I can't place you, and then she's like, "Yeah, you took care of me, and you did such a great job." I'm like, and I think about that, how you impact people, and I think just being nice, being kind helps. There's sometimes the dad voice has to come out, but for the most part, it's like, there are some people that just, you just remember, it just sticks in your head.
It's the same thing for, like sometimes I think to myself, like, some of the things we see, we see some crazy shit and we just don't even think about it. We're like, you go home and you're like, oh yeah, what'd you do today? Well, I did CPR twice today. And you're like, uh, you know, uh, two, yeah, you're 2 for 2 or 1 for 2, you're like going, and I don't say we get callous about it because I don't think we get callous about it. I think we hold it in the honor that it is. But I think like sometimes you get kind of numb to it when you think about like for someone who doesn't deal with that every day, that day was like a life-changing event, right? Like that day was
Oh,
something. And,
absolutely.
and to you it's Tuesday, right? Like to you, you're like, yeah,
Like,
that was Friday. And you realize that sometimes we have a bigger impact on these people than maybe we realize. And I think that's kind of one of the cool things about nursing.
yeah, we, we don't, one of the differences with freestanding versus the main is we don't have a lot of people die on us there.
Yeah.
And we had one guy who was at another hospital, came to us, said that he felt like he was going to die, that he couldn't breathe. And sure enough, when they say that, you're like, oh crap, don't say that.
Isn't that
That's
always a bad sign when someone comes in and
yeah,
goes, I feel like I'm gonna die? And you're like, you just might.
yeah,
You're like, oh, holy cow. Like I've seen that. I don't know how many times I've seen that where people are like, I feel like I'm gonna die. And we're like, well, we're doing everything we can to prevent that.
yeah. And he did. And then his girlfriend was in the room the entire time. And I remember kind of coming over because I guess I feel that I'm sensitive to family members being in the room. And I think it's great that they can be in there, but I think you really do have to have somebody with them if you can.
100%.
And because I have, such I've had a couple experiences that just show that, just having somebody there to explain things to them makes a world of difference. And I remember trying to get over to her, and this guy passed, and we're doing everything we could. And I mean, we literally had just about everybody in the emergency department in that room. And when it was after he'd passed, staff was having a debriefing, and up on the wall we have security cameras so we can see outside the building and stuff. And I saw her sitting out there on this little post that prevents cars from running into the place. And so I left the debriefing and I walked out there and I just kind of sat with her. I said, I'm sorry. And she goes, I know you guys did everything. She goes, every single person in here working was in that room. She goes, I wish it hadn't happened, but I wish I would have came here first and honest. I'm like, I don't have any good words to say, um, but I just want to make sure that you're okay.
Yeah.
And she's like, yeah, she goes, I'm good. And, having personally walked that path myself, it's always nice when I think I'm more prone actually to checking on the family and friends that are in the emergency department too, because a lot of people like overlook them. Although, like, the husband is asking so many questions. Well, the husband probably wants to know,
Yeah. He's
and
probably scared,
yeah,
right?
and
Like I always, and I've been in that visitor chair before and in that, patient chair. And I think I have a little bit different attitude where I'm like, I feel like in my role now, like my role is to be that patient advocate, that family advocate, and be there and where I'm not as maybe as involved in the resuscitation, but maybe I'm like in that support role. And I think that's an important role. It's a really important role.
yeah, and the first time I ever had any family in a code, I was the one that was standing next to him, and the guy came in and said, "I'm gonna die. I'm gonna die." It's like you just know in your heart. It's like, don't say that, but you know that it's gonna happen.
Yeah.
And then, especially when you see like the EKG monitor, you're like, oh my goodness, no.
Yeah.
It's like ready
Yeah.
for this.
I'll
But
never I'll never forget this guy that came into the emergency department and he looked so bad and he looked so sick. And I remember the doctors like talking and they were like they had no idea what was going on. And they're like, okay, it's not this, not this, not this. I don't know what the hell's wrong with him. And I remember, hearing the doctors having that conversation and the guy just looks at me and he goes, and he's like, "Am I gonna die?" And I'm like, "We're gonna do everything to prevent that from happening, sir." And "Well, it seems like they don't know what's going on." I go, "Well, the ones who know are kind of talking to the ones who maybe don't know." But you have some of the smartest doctors that I've ever worked with here in this room. Like, we're gonna give you your best shot." And I'm sitting there in my mind thinking, "Oh yeah, dude, you're gonna die. You're gonna die today." And it was what I was thinking in my mind, but of course, I'm not gonna say that. Um, a year later, the guy came back and he looked exactly the same. He looked exactly the same. I'm like going, this guy, holy, and like as soon as I seen him, I like flashed back to the year before where I was like going, thinking to myself, like, this guy's not gonna make it. And there he was a year later. And I was like, hey, the good news is we've seen this before. And he's like, yeah, I guess that's true. And he was okay then too. So it's it's always interesting.
I always tell people I never talk bad about the providers or coworkers.
Never.
We had a nurse extern. He was a nursing student, just kind of putting in hours. Like he could do certain things like start IVs and do some things. And he was really good. And he was in on that code too. But I go, hey, this is the amazing, you know, James, not using his real name, but this is the amazing James. And he was like, why do you do that? I go, because I want people to know that you're cool and that you're good at what you do. I want to build you up. And he's like, I appreciate it, but you don't have to say that every single time. I go, yeah, I do. I go, because you are good and you're going to be an amazing nurse. And they had a debrief for the staff, and it was just he and I that attended that debrief. And I could tell that it impacted him a lot. And he told me that he was glad that I came to the debrief to support him, and that he really appreciated all the encouragement that I'd given him in his, just student nursing career. So yeah, it's like, yeah. I mean, if I don't think they're good, I'll just say this is your nurse. I'm
Yeah.
kidding.
We had a we had a case the other day where we took a patient from from medical to the ICU and we get there and the staff's getting the patient settled and I'm just kind of there for support and I take the wife and I walk her to the waiting room and I said, "Hey, I'm gonna have you wait in the waiting room for a little while. Just give us a few minutes, get him settled." And I go, his ICU nurse is so and so. He's an amazing nurse. He's really great, and he's gonna take really good care of your husband. And I go, he's in great hands. I go, this guy's one of my favorite ER nurses or one of my favorite ICU nurses. And and that's true. He is, and he is amazing. But I'm always like you. I'm always like, let's build him up. Let's say, hey, this is so and so. I always try to introduce the people by name. Say, hey, this is so and so. She's gonna be your nurse. Say, you're gonna love her. She's great. Or I'll be like, or I'll joke around if the patient, if I could tell the patient's, okay with that, and you get that vibe that someone's going to be kind of laughing and joking. I'll be like, hey, this is Roger. He just got out on the prison work release program, and he's fantastic so far. He's going to take great care of you. And
Yeah,
you
I've
get a
done
little
that too.
chuck.
Yeah, you have to be careful though with that one, but
You
yeah,
get a little chuckle out of the patient, but you got to do it. You got to do it very carefully,
yeah,
right? I went into one patient's room the other night, and I was getting ready to start an IV, and she goes, "Well, you good at this?" And I was like, "Yeah, I'm okay." And she goes, "Oh, okay." And I'm looking, I found a vein for her, and I'm like, I think we're gonna be all right. And then starting the IV and get the IV going, and she goes, "Huh." I get the IV, and she goes, "Oh, I guess you are pretty good at this." I go, "I have a brand new glass eye, and it's been life changing." And she's like, looking at me like, "What?" She's looking. You can tell she's looking real close, going, "You have a glass eye?" And I'm like, I'm just messing with you."
it's funny when I used to joke with people before I started the IV, like, "Hey, this is my first time,"
Yeah,
whatever.
yeah, I've said that a million times.
And then you blow it, right? And you're like,
Yeah,
"Yeah,
and then they're like,
it is the
he was
first time."
telling the truth.
So I started doing it afterward, and when I get, I'm like, "Wow, that's my first one ever." I'm like, YouTube. I watched this thing say, start with confidence. How'd I do? And they're like, "This is really your first time?" I'm like, "Yeah, today." And they're like, "Oh, okay."
When I
Or
when I was a EMT in the emergency department, my very first IV on a person who wasn't a classmate, I went to my intermediate clinicals for the first time in the hospital, and the lady goes, "Well, how many of these have you done?" I said, "You wouldn't believe how many of these I've done." Just left it at that. And luckily I got it. And the only reason I got it is because there was a woman named Annette who was very kind and very patient and did a great job with me. Um, and salvaged an IV that I clearly missed. Um, and then guided me so that I got it. But I got it with her hand on my hand and her pointing to where I should go. Um, but it takes time. It takes time, and I'm like you, and that there's been a million amazing nurses who've helped kind of show me the way, and I try to do the same thing for people around me.
yeah. And it's funny when coworkers know, like when they know that I've written a thoracic chapter in the trauma book or something, they are like, "Oh my gosh, I did not know that you were this smart." I'm like,
Yeah, it's one thing we didn't talk
"Got
about. We
it."
talked a little bit before we started recording. We talked a little bit about the fact that you're an author. You've authored a few chapters for a couple books. Got another one coming up. You're really trying to make an impact on this profession here of emergency nursing.
Yeah, you try to leave it in a better condition than when you left it or when you found it. You just kind of leave it better. And legacy, like I said, it's paying back. It's what can I do to give back um, to the profession. I when I did honestly when I floated down to the emergency department that one night, it was the first I'd been in the Air Force for 5 years before I went to nursing school. And I was a medic in the Air Force, and so I worked at a little emergency department on a base hospital, and so but I was like a EMT or a medic there, and in our so I had some emergency department exposure, but when I got floated down, and I was like, this is where I need to be. And I remember going home and telling my wife, I need to go there. And she's like, then apply and go. I'm like, I will. And I got hired, and it's like,
That's cool.
and I really did kind of feel like I was home. It's like, oh, yes, this is where I need to be.
That's
But
awesome. I love hearing that. That's super
and then
cool.
every step of the way, there's when I was their first educator, then I was their first trauma coordinator, and then then I went off and did something else, and I came back and doing charge nurse now. And part of it is just that, you know, you kind of just got to let people do their thing and do it. And it's kind of fun. We have some new grad nurses who are just enthusiastic about being a nurse. And I'm like, I don't know if I was ever that enthusiastic about being a nurse, but I appreciate that because they're so eager to learn. They're open and they're like a sponge. They just soak it all up.
Isn't it great to see where you're like, you're really into this. This is cool.
Yeah.
I
Like
love
they
that.
have their notebooks, they're writing down notes and everything. And then it's funny because I had this new nurse who had to give this lady with liver failure a KX late enema, and they were supposed to hold it for half an hour. And she's like, Roger, she's not going to hold it. What do I do? I'm like, well, let me think about this for a second. And so I'm like, all right, here's what we're going to do. Let's go to the stock room. She goes, the stock room? I'm like, yeah, I need some motivation here. So we went back and we found this large Foley. And basically what we did is we put a Foley in and then hooked it to a bag. But then we inserted the KXLate and then we clamped it for half an hour. And then after half an hour, then we unclamped it and then it all drained into the bag. And it's funny because that one thing, right? And to me, I was like, I just don't want to clean up a mess, was my whole thought process. Because I know how messy those are. I don't want to clean up that mess. And so I showed her and she's like, oh my gosh, Roger, that is the best thing I've ever been shown ever. And so she's going around and she was telling other people how to do it. And I'm like, you go. I go, it's yours. You can own it. You can say it's your idea.
That's awesome. That's
But yeah,
awesome.
it's being around people like that that really do kind of energize you, especially as an old crusty nurse. And sometimes you're like just like, you're an old dog that like snaps at everything, and
Yeah.
nurses think that, oh my gosh, he's horrible. He's just gonna snap at me.
I've worked with that nurse, man. I know that nurse. Like and there may be times that maybe I was that nurse. I don't know. I hope not. But there's maybe times where maybe I didn't seem as approachable. Yeah,
Yeah,
I remember meeting somebody for the first time when I was really cranky and I was kind of coming down on somebody, and I was like, I'm not usually like this. Just please understand that. And they were like,
yeah. I was told recently I have uh, intimidating dad face.
huh.
Like intimidate. Oh, that's a new one.
You're like, oh,
Well, is
that's
that like the male version of resting bitch face or what?
it sounds like it. Sounds like
I
that's kind
know,
of
right?
something.
I'm like, it's kind of intimidating dad face. I'm like, well, okay, good to know that I have that because I'll
You're
use that
like,
to my advantage
you're
now.
like, you're like, dude, I'm just old. That's all.
I know this gray hair is from my son. Don't worry about that. But yeah, but it's funny that they really don't know how much you know. And I think a lot of them are like too afraid to ask. And I
Yeah.
think you'd ask on your little thing like, what advice to new nurses, or three things to forget, or three things to remember from nursing school. And I would say, one of the things is that don't be intimidated by people. Just go up and ask them. I mean,
Yeah.
people need to share
Great
stuff, and
advice.
nurses. I think nurses are the most creative, um, generous group of people because they will share things with you. They will help you out in a pinch. They will share their knowledge with you. There are some times, and there are some times I've done this as well. That's like you got to learn this one on your own. Almost like being the dad. But, um, but yeah, but it's just don't be afraid to approach somebody and say, "Hey, how do I how do I do this?" Or always,
Yeah.
you can always ask for help. It's not on you. You don't have to be responsible for knowing it all or knowing how to do it all.
Yeah. I
There's
mean,
people.
I tell people all the time, I've been doing this for a while and there's still shit I don't know. There's still like, people are like, I said something, I asked someone a question that was like something I probably should know. And I was like, I don't know the answer to that. And they're like, oh, it's this. And I was like, okay, thanks. I don't have it all figured out. Sometimes I'm flying by the seat of my pants too. So
I worked with a nurse who would come up and ask me something. I'm like, I don't know. Go look it up. And then she'd say, but this is what I would do. And then she'd go look up the policy and she'd do the exact opposite of what the policy and what I told her. I'm like, don't come to me for advice anymore then. It's like if you're going to do the exact opposite,
yeah, if you come for advice, take it,
maybe I
take
should
advice,
start giving her the wrong advice. But then if
and
she
she'll do
did
it
what I
right.
said, then it would be like on me. It's like,
Right. Now, one thing I usually do. So now one of the things I usually do is I kind of wrap up the podcast. You got it started, that question called three things, but I want to do something a little different with you.
all right,
One of the things that you do all the time and your Facebook page, and if you're not following Roger on Facebook, he's definitely a great follow.
yeah, that's fine.
Um, one of the
Hey,
things that you always do is one of the things you do is you do top 10 lists,
yeah,
um, which I think are awesome. Like I think your top 10 list, some of the stuff you put on Facebook, like just your thoughts are like, wow, this is really profound. And this is like really good. And you did one, I just looked, you did one about the winglets on an airplane recently.
Yeah.
And that was like, I was like, that's fucking great. I love that. I think that's so great. And I was like, I got to get him on the podcast. That's, one of the things that made me go, okay, I got to get him on the podcast. But you do top 10 lists a lot, and you have some really great ones. Are there any that you're like, this is my favorite top 10 list?
I think the favorites are the ones where I get people to collaborate on them. Like I've had a few where I've done them at work, and because medical people, our sense of humor is so different than normal, and
True.
we think it's normal, but it's so different. Probably the favorite one I had, and I'll have to find it, was the top 10 rock bands named after medical conditions or medical stuff. And this was during COVID. So we had the one that was the funniest one is we have a PA who's hilarious. Some of the band names were, my favorite was Sonic Panis. And if you don't know what a Panis is, that what makes it even funnier.
Yeah.
We had the Fauci Jazz Ensemble and the with the three boosters or something like that. Um, but I remember that one. But the ones that are the funnest ones are when you have people kind of like helping out or collaborating on them. But if I can find the one that um, the top 10 band names based on medical terms or something like that, I can't remember the title, but yeah, that one was pretty funny. Sonic Panis, it's funny every time I see that PA, I always laugh and go, dude, how's Sonic Panis playing out for you guys? Like, you guys on tour still? And he just starts laughing.
It's gotta be the name of the episode of your first podcast, Sonic Penis.
Yeah. But no, they're just like little, I don't know, just things that I think about. Like, um, I think Hallmark movies gets a lot of top 10 lists just because, like, um, they're funny because they're so predictable
That's
and
funny.
funny. Just random things. And it's kind of like my way of ranting in some ways.
Yeah.
Another one that I did, it was kind of funny. If I could find it, was top 10 things you notice in a drive-through. Like you have the guy that's blowing coal in his truck in front of you. You have the person that drops the money and has to open the door or try to open the door and pick it up. And then like I always get sent to timeout for some reason, so I have to go pull forward. It's like, why do I get in timeout? That guy ordered like 20 things. You guys should have had my order done by now.
Happens to me all the time. If you throw off one thing, it just messes them all up. So
I yeah, I put them in there. Actually, if you could probably search for him on Facebook if you do hashtag Trauminator top 10, because I put that hashtag on all the top 10 lists. So you could probably search on Facebook for him.
I'll take a
Hashtag
look.
top 10. But yeah, and there's some serious ones too. But most part, they're just like, I just got something in my head. I can't get it out. So I just
Yeah.
throw it on a 10 list. I don't even remember how those started, to be honest with you. I just started.
I love it. Like whenever I see it, I'm like, it's always like something I can totally relate to. It's always something I'm like, oh, it's perfect. Thanks for taking the time to do this with me. I really appreciate it.
Thanks for listening to the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.